Hello world, my name is Kundlas and I'm a primary care physician in Central Florida. These days, I'm visiting India to oversee and coordinate care of my father and my uncle. They are my best men in this world. My father has been my intellectual guru. I have learned how to plan, persevere, and to weather most of storms of life from him and always look forward to him in case I have some problems in my life. Other one is my father's best friend, and he has been my spiritual father. Every time there is any emotional dilemma, we rather go to him and get dispassionate advice or just talk to him for 10 to 15 minutes and we will find the answers and we will be calm, quiet. Age is magical and it consumes best of us. And that is happening to my father and my uncle. And I want to share stories about how a good coordinated care could make a difference in the final outcome. Me and my brother, who is also a family physician, have been very upfront with our father, talk to him what he wants, how he wants it, when he wants it. Up till last year, he used to visit us in the United States and he will stay with us for 6 months and then he will spend most of the time in India among his own people who have been caring for him for many years. And the social culture, food, friends, and he always felt comfortable. This time, he refused to go back to the United States as he does not want to burden his family. And above all, he feels much better and more comfortable in India. But we have prepared ourselves for this day coming and we were all okay with that. He is very well taken care. He has a lot of comorbidities, but he's very clear about his choices. He is having a very decent quality of life. Whereas my uncle, who has been recently diagnosed with metastatic bladder carcinoma, and he has gotten the best care in India, but unfortunately, the care has been not coordinated well. All the doctors here have provided him with the best treatment options without asking him what he wants. He is a man who has lived full life, always made right decisions in his life, and wanted to leave this world healthy and on his own terms. When I came to know that he has been sick and he has been getting chemotherapy, I knew very well that is not something he would have liked. I talked to him and came to know very clearly my hunch was right. He kept on telling me that all the doctors are giving him the best treatment in the world, but nobody is listening to him. Nobody's coordinating his care. Nobody's asking him what his choices are. Today, I was able to put whole team together, including his urologist, his oncologist, and they all were very good physicians. And they also wanted to offer him palliative care and not the curative chemotherapy and radiation and other modalities. But nobody coordinated his care. Nobody talked to him what he wants. He just gave in his way to the emotions of the family members and the medical jargon. Today, when he was given choice to talk, he very clearly expressed himself and told him he wants to leave this world not in the hospital, not getting infection, and he wants to stop all the treatment and he wants to enjoy rest of the time what he has in this world. These two stories, though, are very dear to my heart, but there is a sharp contrast in how coordinated care makes a difference. At Shield Medical Group, we take pride in coordinating care, and I think this emotional experience which I had will make me more committed, and I think I will be a better doctor and I will possibly pay more attention to what my patients want and what their options are and how to do the best treatment for them. Usually, as medical doctors, we sometimes forget that what our patients want. Most of the time, we are busy saving lives and that becomes mission of our life. But every good life has to come to end, and I think leaving this world in a respectable way is more important than being not upfront with them and discussing the realistic outcomes and prognosis. I think a lot of lessons are learned during this visit. I think I will be better prepared to talk to my patients regarding their advanced directives and will better coordinate care and ask them their options. Thank you very much for joining and listening to my story. We will continue to share our heart with you guys. Thank you very much.